The planning will get underway this fall with an anticipated completion date of 2029, which will come, seems a long way out, which will come very quickly. And when the doors open at the new Juravinski Tower, this site will be the largest inpatient hospital in the region. So a massive undertaking that we're all very, very excited about. Secondly, Minister Elliott also committed funding to support the expansion of the emergency department at the Hamilton General Hospital. The plan will increase the footprint of the existing ED by as much as 50%, and it will greatly improve the layout and the flow for anybody who works there or has been through that department. Because of the pressures that we're experiencing, we are challenged to ramp up in terms of our pre-COVID surgical and procedural activity. We did get above the 70%, closer to 80% about a week and a half ago, but we've had to reduce back to 70% because of the health human resource pressures that we have. We also need to always be cognizant that we have to remain accessible to our regional programs and also respond to those that arrive in our emergency departments. So again, our ramp up will be very slow and it will be a very gradual process. We will aim to try to get back to the closer to 80%, but it will be into May before we see that number.
We do have hotspots, though, that we are focusing in on, nursing roles in particular, such as the OR, the ICUs, even including PICU, pediatric ICU, NICU as well, oncology, medicine. So those are some of our real hotspots that we're really trying to understand what can we do differently to improve those pictures. Respiratory therapy is another focus, pharmacy techs, DI, and some of the specialties, particularly MRI. And even our physician workforce as well, anesthesia and internal medicine surgery. Are some of the dilemmas that are on our radar to try and look at ways of addressing this. So we are definitely thinking about these workforce pipelines. Our clinical extern program is a great example. Ministry of Health investment into the extern program. We've had over 300 people go through the extern program, and this is where we've got learners, could be in second, third, and fourth year undergrad, where they are actually hired on as non-regulated care providers along with our team members who are providing that preceptorship, but they are paid as part-time employees to really gain some of that experience. And we also have formal roles in place, a great team of preceptor coordinators who are helping to mentor individual learners.
These are the provincial predictions from the science table for March 17, and as you can see, it's quite linear in terms of increase over the last few weeks, but certainly higher than what had been expected, and they revised their models by April 14. These are the predictions for hospital admissions, which go into the range of where we had been at peak in mid-January, depending on which scenario you pick. The good news here is we are actually running better than the best case scenario. So probably the truth will be somewhere between that best case scenario and the previous model, the outdated model that I've shown you previously.
Please take the time to review the allergy high impact workflow by reviewing the tip sheets and demo videos available on the Hub and on the learning management system. And think about how this high impact workflow fits within your day-to-day practice. Our Odyssey and Epic team have completed their build and testing, and this is a great milestone for our project. With over 2,000 engaged staff and physicians collaborating across dozens of work groups, HHS version of Epic is built and all testing have been completed in time for our go live on June 4th.
Thanks everyone for joining us. We really appreciate that you would take time out of your day to join in, and we do hope you found the content valuable. And again, please forward any questions you may have about the content or suggestions to hhsnews@hhsc.ca. Thanks everyone and have a great day.